Copyright, University of South Australia. This recording may contain third-party copyright material. Apart from any use permitted under the Copyright Act 1968, no part of this recording may be reproduced or rebroadcast by any means or process without the prior written permission of the University of South Australia and the copyright owners.
Welcome to a short video on the neurovasculature of the pelvis. Now, when we're talking about arteries, nerves and veins, they need to run from different regions of the body to another. Now, any nerve is going to be named after the vertebral level that it emerges from, whether it be L3 or S1 or S2. Now, these can come together and form larger bundles, like a bundle of spaghetti inside of a packet. And that's going to run through your body just like the femoral nerve or the sciatic nerve, and they're going to carry multiple segments. So like as an example, your femoral nerve is L2, L3 and L4. Now arteries and veins are obviously associated with your cardiovascular system, and they're going to be arising from the heart and taking oxygenated blood away from the heart to your organs, and then veins taking the oxygenated blood back towards your heart. Now these are all going to run together as pairs, as neurovascular bundles. So a neurovascular bundle will consist of an artery, a nerve and a vein. Now under most circumstances these all have similar names. So we've talked about our femoral triangle before and how that comes together, and that will have your femoral artery, your femoral nerve and your femoral vein together in one spot. So if we just do a quick drawing about how veins and arteries normally work inside the body, is they're going to come down from your heart and they need to move out to each leg. So a bit of a schematic would show us that an artery coming down from the abdomen or something like that will come down from a larger one and then split into smaller ones to move off to different regions. So if we draw the abdominal aorta as an example, coming down, now this is, you can feel by your belly button. So if you lay down and push hard just below your belly button, just above your belly button, sorry, you'll feel your abdominal aorta pumping. If you've got your muscles of your belly tense, you're not going to be able to do that. So just relax to do it. So it'll get down here to the L4 vertebral level, and it will divide like this, so it can go into either side of the pelvis. It then will get to your sacroiliac joint and will divide again to split into one which goes inside the pelvis and outside the pelvis. So the one that goes inside is going to go and supply your pelvic organs like your urinary bladder and things like this, and the one that's going outside is going to go towards your thighs. Now it'll continue past a special ligament called your inguinal ligament, and at this point it will change its name again. So if we label these parts, we've got this large part here, which is the abdominal aorta, this part here, which is a common iliac artery, this one going inside, the internal iliac artery, then one going outside, external iliac artery, and then if it was to go beyond the inguinal ligament, it would be called the femoral, as it continues into the thigh. Now the femoral artery will wind up behind the knee at some stage and be called the popliteal, but we'll get to that one a little bit later. Now if we're talking about our nerves and how they work together again, and we move up to this one, then what we can see is we've got the parts of the vertebral column and the sacrum. So in between the vertebrae you have these holes, and these are called intervertebral foramina. Now your spinal cord will be travelling down along the vertebral column. Now in this region here is actually just made up by a bundle of nerves, and these are called your chorda equina. Alright, so your cord normally ends about the L1 level, and then as it comes and they pass out from there, they then pass out. So the one coming here between L2 and L3 is our L2 spinal nerve. Now if we want to make our femoral nerve, we then have a branch coming like this, and a branch coming like this, and all of them, they're going to come together. All right, so all three big parts of this are going to come together, and they're going to make a large peripheral nerve, and we would call this one the femoral. And the femoral nerve, we know it supplies the anterior thigh, so muscles like your vastus medialis and rectus femoris and your sartorius. Now at the same time, from these levels, L2, L3 and L4, we also have the obturator nerve. So they're still made up of large amounts of numbers of axons, but they just follow along, and then they're a little branch. So let's just imagine that a road's gone in a different direction. So you've got a road coming along, and then some parts of it divert off to go to a different region of the country. So this one here is the obturator nerve, which goes to supply your medial thigh muscles like your adductor magnus and adductor longus. Now on this side, so we don't confuse things, all right, it does occur on both sides, by the way, not just the sciatic nerve occurs on the right and then the femoral and obturator nerve occurs on the left, just to make it easier for the drawing. We then have more fibres of L4 come along like this. Then we have fibres of L5 come along like this. Then they meet with the fibres of S1, S2 and S3. So we can see that many nerve root fibres from L4 to S3 have come together, and they all together then end up making the sciatic nerve. Now the sciatic nerve needs to carry a lot of information, and the reason why it needs to do that is because initially it innervates your hamstring muscles, but then once it gets down behind the knee into your popliteal fossa region, it divides into two more nerves which need to carry on their innervation down the rest of the leg, so innervating your leg muscles. Now if we use the smaller drawing here to try and put some of this in perspective, all right, what we can do is, if we follow the artery down, and we'll talk about some of the landmarks that you would have and some of the name changes that you would get in each individual component. Right, so we said before that the large abdominal aorta would be passing down the midline, right, just anterior to your vertebral column. It then gets to your lumbar vertebrae, right, the fourth one, and splits and heads out towards the thighs. Now in this case, remember that the first division was called common iliac. Then it gets to that sacroiliac joint level, and the artery then goes inside the pelvis, right, on both sides. Then it's going to head out past the inguinal ligament. Now the inguinal ligament is a structure which goes from the anterior superior leg spine here to the pubic tubercle here. So this dense ligament actually makes up what's your V-line, or the bottom of your abdominal muscles. So once again, let's label it here, inguinal ligament. Now we're in the region of our femoral triangle now, because as the artery has passed underneath the ligament, it has a name change again, right? So just kind of like King William Road in the city. So you've got Carrington Street that turns into Wright Street, so you've got to change the name, all right? So the femoral artery that lies here would also be bound by the sartorius muscle, which would be coming across this way, and the adductor longus muscle, which would be coming across this way. So now here we can see the region of our femoral triangle. So if you ever asked to draw it, all you have to do is just draw a small triangle which represents that shape, right? Then use three colours to draw in some structures, right? So the femoral triangle, you would label it inguinal ligament, sartorius and adductor longus. Then laterally you would have the femoral nerve, right, that we've talked about on the previous side of the page. You would then have in the centre the femoral artery, and then most medially you would have your femoral vein. Alright, so that's the orientation of those vessels and neurovascular bundle just up here. Now if we continue down, alright, you've got the femoral artery which runs down the medial aspect of your leg like this. Okay. Now what happens is there'll be a big deep branch which runs behind the femur and then also goes up to supply part of the bone of the femur as well. Alright, so this is just called your deep femoral artery. But let's focus on the big one. It will then pass through, right, and it passes through a little hole just here, right, in a muscle, right, and this is called your adductor hiatus. Now a hiatus is a hole or a space where things can fit through, all right, and this is in the adductor magnus muscle, and at this point it then goes posterior, all right, so the dotted line here is representing posterior, And now we're here in behind the knee. So when anything's behind the knee, as far as blood vessels go, we would call it popliteal. Now the popliteal fossa is the name of the space. We had a femoral triangle up here. Now down here we have a popliteal fossa. So this is more of a diamond shape, all right, behind the knee. Now if we're doing it for this knee, this way will then be medial. This way will then be lateral, and then you've got proximal and distal obviously down here. So the medial side of the knee is here, so let's imagine that we're viewing this from the back. All right? It's not just behind the patella, but it's right in behind the knee, between the muscles of the hamstring. So on the medial side, this border here is going to be your semimembranosus. The lateral border here, the biceps femoris. And below, you'll have the gastrocnemius muscle, which is your calf muscles. Now, if you've ever seen the Tour de Latte on a Saturday morning, you've seen the cyclist riding past, all right? So these guys generally have quite big calf muscles, all right, because it's used a lot during cycling. Now, here, once again, you'll then have the popliteal artery running down here, the popliteal vein running down here, and most laterally then you'll have the sciatic nerve, which is going to enter the top aspect of the popliteal fossa, but then it's going to divide. All right, so we talked about the sciatic nerve before having so many nerve fibers, L4 to S3, all right, where it's going to divide into the common fibular one going laterally and the tibial one going medially down the posterior aspect of the leg. Now, as far as the artery goes, all right, once it gets to here, all right, it then divides again. All right, so one artery travels down the posterior aspect of the tibia, so you would call it posterior tibia, which makes a bit of sense. And then another one comes in front. All right, so that's called your anterior tibial artery. Now, as these two progress down the leg, the posterior tibial artery is going to go behind the ankle and underneath the foot through a region called your tarsal tunnel down here. And the anterior tibial artery is going to come like this and go onto the top of your foot. So once again, you've gone past the region of the ankle. All right, so if we label this one here, we know that it's femoral. We label this one in behind the knee. All right, sorry, femoral above. One behind the knee we know is popliteal. The one running in front of the tibia, anterior tibial. The one running behind the tibia, posterior tibial. Now, because they've crossed the ankle, these two here, all right, you've got then this one on top of the foot is called dorsalis pedis, pedis being foot, dorsalis being dorsum, so top of the foot or back of the hand. And we said here that the one going posteriorly passes through a space. All right, so on the medial aspect of the ankle, this area here is called your tarsal tunnel, which will be discussed in a video a little bit later. But once it goes beyond that, then it's ended up being called your plantar arteries, okay, which would then further divide into a medial one and a lateral one. But just for this point in time, know that the arteries on the bottom of your feet would be called plantar. Now, we don't really need to draw a vein in on this segment, all right, because what's really nice is the vein which runs with the posterior tibial artery, the anterior tibial artery, the plantar arteries, the popliteal, femoral, etc., even right up to the ones where we drew earlier over here, like your common and external iliacs, has the same name. The only time that it would differ is when you have a large venous structure running up the anterior aspect of the vertebral column, which would be called your inferior vena cava. All right, I hope that's been helpful, and we'll see you in the next video.